Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Miele, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Hello and welcome to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele, and each week I get to join you with important topics and information from leaders in our community who are helping keep our community safe and geared toward a safe community in COVID-19 can certainly be a challenge. And that's why I was really excited to have the opportunity to interview the Director of Emergency Operations for Mutual Aid Ambulance Service. And his name is Lorenzo Garino. He is on the line right now. Mr. Garino, thank you so much for joining us. I really appreciate it. How are you? And how are you dealing with these challenging times?
I'm doing well. Thanks for having me, Jen. This year has certainly been a huge challenge for us that we didn't see coming. Wasn't something that we ever expected to have to handle. But here we are. We're hanging in and still going strong almost a year in.
That's amazing. So before we talk any details about COVID-19 and the challenges and the changes that you've made, I want to hear a little bit about you. So tell me where you grew up, what your education is like, and how you ended up in the job that you are in now.
So I actually grew up in a small town, Smithton, Pennsylvania, about 20 minutes from Greensburg. I received my paramedic education actually here at Mutual Aid Ambulance Service, and I spent some time working in Allegheny County in the field prior to overseeing EMS operations at Presbyterian Hospital in Pittsburgh before I came to Mutual Aid.
Wow. So you certainly have a nice, long and meaty career in emergency operations for sure. Why don't you tell us a little bit about what your daily work involves? How many people do you have to oversee there at Mutual Aid?
So what a lot of people in the community don't know is that we're actually the largest non-governmental ambulance service in the Commonwealth. We serve 39 communities in both Westmoreland and Fayette County. And at any given point during the day, we have upwards of 32 ambulances, a complete service 911 dispatch center, billing and business office, as well as a full-time education department here within house. So a general day for us, like I said, we oversee about 80 people on shift during the day. That drops down to about 40 at night sometimes. And we generally handle upwards of 300 calls for service in a 24-hour period of time.
That's amazing. I mean, that takes a lot of training, a lot of employees, a lot of coordination. And you don't just service local hospitals. I mean, you're going back and forth to Pittsburgh quite a bit as well.
Probably about 24 times a day. We're taking trips back and forth to Pittsburgh. What a lot of people don't understand about the ambulance services, once these folks arrive at the hospital and receive their care, sometimes they do need, safe medical transportation back to their home or a skilled nursing facility or a rehab center. So part of that is what we do as well. So it's not just responding to emergencies.
Well, yeah, those transports home can be just as critical because if they're not done well and they're not done right, then the patient may end up back in the hospital. So I'm sure they're very grateful for you. Now, do people have subscriptions to Mutual Aid or, how does the billing part work? How do you pay for something like that?
Well, what's really interesting is that we don't receive very much funding in tax dollars. It only equates to several $1,000s a year. So about 90% of our revenue that keeps us going for the community is derived from billing insurance companies for ambulance transportation. Over the past probably 10 years, the changes in legislation that have come from the state and federal levels have made it very, very difficult for us to collect those charges. Mm-hmm. So what we've had to do, as with every other ambulance service, is to create the ambulance subscription program. That generally rolls from April 1st to March 31st on a yearly basis. And we're getting ready to come out with ours for the 2021 calendar year. And what that does is by purchasing an ambulance subscription, you're giving those critical dollars right back into our operation, which helps us buy new equipment, train our providers, retain providers, as well as respond to emergencies. So those dollars are very critical for us to continue to exist. And without the membership program, I don't think that we would be where we are.
So what does the person who is subscribing get? What are the benefits to someone who is interested in a subscription?
So in return for the subscription, we generally offer 50% off of your copays. Unfortunately, we're not allowed to help you with your deductible by law, but we are able to offer lower charge transports home from the facility, and it does assist you with the wheelchair van service as well, should you need transportation in that manner.
So important for the ever-aging demographic in Western Pennsylvania. So how go about getting one of these subscriptions? What should you do and who should you contact?
So what we're prepared to do for this year is send out a mailer to every address within our communities. So you should plan on receiving one of those mailers sometime in late February, early March. There are some people that we do miss. They could call our business office at 724-837-6134 or online at www.mutual-aid.com.
Very good. So that information is certainly available on the website, and it's a critical need to have excellent ambulance service in the community, but there's also a cost to that, which I'm sure you have to balance all of the time. For years, I sat on the board of directors for Rescue 8 in North Huntington EMS, and I watched the profit margins become more narrow and more narrow and more narrow because of the reimbursement rates. I saw the challenges that came with trying to balance, the revenue generation from bringing the patient back from home to the hospital, but also making sure you have enough staff to take care of the emergencies. So I certainly applaud you for the work you do and how challenging that must be. And I think it's really important that people know that the individuals who work for mutual aid and other ambulance systems are really committed. I mean, how many years were you out on the road running and taking care of people? I mean, you really have to have a passion for that, right?
Yeah, it's very challenging. We pride ourselves on our retention. We have a lot of providers that are very, very tenured with 20 or 30 plus years of experience. So these folks are very dedicated. This is something that they pride themselves on. Obviously, there are better opportunities in the healthcare and public safety field. However, these folks choose to stick with us and continue to care for their neighbors.
It's kind of addicting, isn't it? The lifestyle, the sort of the running, the adrenaline, the emergency, right? I mean, it's kind of a lifestyle.
It really is. It's something that's hard to explain to folks who don't understand it. Obviously, you see a lot of things that are unfortunate. However, a lot of the people that you care for really leave a lasting impact on you, and that's not something that's easy to get away from once you've had those encounters with people.
Right. Recently over at the Diocese of Greensburg, we featured one of your EMTs in a campaign that we did. She's a lovely young lady, and she did a fantastic job, was a great spokesperson. This industry needs young people, right? I mean, you need young people coming in the door and learning the ropes and learning how to take care of people. So how do you recruit people? How do you get them on board?
So interesting that you mentioned that. One of the largest challenges that face our industry right now, even larger than financial sometimes, is the ability to recruit and retain employees. Us and other ambulance services in the area all struggle to find people to staff the ambulances and respond to emergencies. Unfortunately, as the education requirements increase, which is a good thing, it also becomes very difficult to find people. It's often more appealing to go to school for nursing or some other type of position that requires a similar education. What we found great success in here is that we have one of only a few accredited paramedic training programs in Western Pennsylvania. So we bring people in from the ground up. We find people who are younger that are interested in public service. We put them through the EMT program. We generally employ them for a year or two before they decide to further their education. We offer them an incentive to take their paramedic class with us. It's a deeply discounted program that we allow them to pay for over the course of a year. And for that, we ask them for several years of service in return. So our homegrown education and retention has really helped us stay ahead of the curve as far as keeping providers in ambulances and responding to emergencies.
That's a fantastic way to do it. I mean, you build the school, you educate the students, and you hope that they stay with you. And when you have a good culture and a good retention rate like that, you can see that it's really working. So you must have a pretty significant education department then. Why don't you tell us a little bit about them?
So our education department, we're actually in the process of increasing a lot of their capabilities. We have several $100,000 worth of simulators and mannequins and different things to really help the educational process. At this point in time, we have 3 full-time educators that work in our department. 50% of that time is spent educating new providers in the community. And the other 50% of that time is competencies, skills reviews, and continuing education for our current providers. So one of the nice benefits about working with us is that we assist our providers and our employees in every way possible in continuing education, and the next steps in science, whatever may be coming out, is offered immediately to our employees. Unfortunately, due to the pandemic, we've had to cut back on our community CPR classes, which was something that we offered really truly to a lot of people in the community. We also provide the advanced cardiac life support and the pediatric cardiac life support, which is a certification that a lot of other healthcare providers like nurses and physicians and respiratory therapists would require. And they actually receive a lot of that education here at Mutual Aid, even if they're not employed here.
I mean, this is very intensive training, and it's wonderful to know that people are going through this. And we're going to talk about the impact of COVID-19 in just a little bit. But community outreach has always been a big piece of mutual aid too. I mean, you're not just there for emergencies, you're there involved in the community, and you encourage that. That's tremendous that you do that. Those classes, let's pretend that we fast forward a year from now and someone is interested in coming to a class. Is that all information that's available on your website?
It is. If you go to mutual-aid.com, you'll find that a lot of our educational resources are on there. There's a phone number to call that goes directly to our education department. You can speak with somebody immediately, and they would guide everybody through their process. And that's not only for individuals, but that's for groups, church groups, community groups. We will come on site if you do have a large enough group, and we'll do that education right in person for you.
Is there sort of an age minimum for something like that? Do you train the Cub Scouts and the Girl Scouts and things like that?
We do. We have everybody from 6 or 7 years old to 80 or 90 years old. One of our big initiatives as we move forward through 2021, once we start to be able to host different functions again, is we're going to put a large push on our communities in Westmoreland and Fayette County to educate the community in CPR. What we find is a lot of times when we respond to cardiac arrest situations, folks maybe could have done more should they have been educated. So we're really hoping that our cardiac arrest survival rate can go up in our community through our education efforts. And that's something that we're going to push as an organization very heavily as soon as we're able.
I love that. I think that that's a tremendous initiative, and you're exactly right. You are training sort of the next generation of lifesaver, getting people out there who are there before you guys can even arrive on the scene. That's fantastic.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of Citizens Fiber.
Well, if you're just tuning in, welcome to Westmoreland Community Connections, only on WHJB. I'm your host, Jennifer Miele, having a fantastic conversation today with Lorenzo Garino. He's the Director of Emergency Operations for Mutual Aid Ambulance Service. You're so interesting. I mean, this time is just flying by. You know so much about Mutual Aid. You grew up in the business, and now you're a leader in the business. So, of course, I'm going to ask you about the changes due to COVID-19. I mean, can you believe that we're coming up now on a year of these restrictions, a year of these changes, when we were hoping that it would be over we thought it would be over by summer, and then we said definitely by Christmas, and now here we are again. So take us back to February, March of 2020, and what you guys were hearing and the plans that you started to put into place.
So it's very interesting because when we first began to hear about this, we knew that it was going to be a large undertaking. And pessimistically, we kind of figured that it was going to be a little longer than a few months. However, there was a lot of guidance from the government that was coming out that was aimed towards hospitals, extended care facilities, and the community, but there was really nothing for us. So we were on our own to try to figure out a game plan for this situation. Fortunately, we have a very close partnership with Excella Health here in our community. And Excella Health's physicians and administrators were able to meet with us and help us plan and guide this process. So had it not been for Excella Health, this process would have been much more difficult for us to navigate. We immediately began to purchase stockpiles of PPE that we didn't have available to us. And that came at a pretty significant cost.
Oh, yes. I'm surprised that you were able to get it. Fortunately, you were able to get it.
We were very fortunate. We didn't receive much help from anyone. It was just relationships that we had with vendors. Fortunately, they kept us in mind. We were able to get a little here, a little there. We're still in the process of purchasing that. At this point in time, we're well over $600,000 that we've had to invest in PPE, and it's just been here and there.
That's amazing. And so you put that into place. Excella comes in to help. And what are the 3 or 4 biggest changes that you had to make to your operation?
So immediately we separated everyone. As you can imagine, some of our larger stations, we may have 20 or 30 people working at a time in, and just having everybody isolate, begin to wear their PPE at all times, the mask at all times was very challenging. But what a lot of people don't see is that the amount of cleanup that is required after transporting one patient that we suspect is under COVID. It was very important to us immediately to stop that spread, was to make sure that each patient that got in an ambulance was clean, sterilized, and ready to go. And that gave people some comfort that they could still continue to call 911 for non-COVID related issues and that they would be safe.
Now, you have to say the business, the EMT paramedic partnership, whether it's advanced life support, basic life support, it's still all done in a team setting. You still have 2 people working together all the time. So that had to present a challenge as well for exposure.
It certainly did. Fortunately, the guidance that we received early on allowed us to advise our providers that at all times while in the building, they had to wear both an N95 mask and a surgical mask. We think that extra layer of protection, although it was inconvenient and generally uncomfortable, provided our people with the means that they needed to stop the spread. So we were very fortunate in that regard.
Yeah, excellent. I mean, and again, the fact that you were able to get the N95 masks, because you remember at the beginning, when you would see the nurses on national television who, were saying they had to wear the same mask for 3-4 weeks at a time. So, that was very fortunate. So tell us about what happened to call volume at the beginning. Did it kind of drop because people were afraid to go to the hospital? And then, has it resurged? What's that like?
So it's been kind of a roller coaster, Jen. At the beginning, the immediate shutdown, we found that our call volume actually dropped about 65%. So the first month or 2 months was very, very, very low. As we got into the summer, it seemed like COVID was almost an afterthought. I'm not sure if you feel the same way.
Yes, yes.
But, you can still feel the lingering effects. And there was a few patients here, a few patients there, but it started to normalize. And then as we got out of the summer, around September, October, and November, we were about 30% over the third quarter calls from 2019.
Wow. And that's interesting. So how many are COVID related? How many are not? I mean, what is the breakdown these days?
Well, that number kind of ebbs and flows depending on the demographic, which station the crews are based out of, and where it really seems to be spiking that week. However, what I can tell you is that we've transported nearly 3,000 COVID patients thus far just in our organization.
Oh my, so scary. And are there commonalities? I mean, are these mostly the elderly, or are you seeing, I'd like to say younger people like myself, but I'll say younger people like you. How about that?
What we've found is that it's across the board, male, female, younger, older. Everybody is being affected by this. There are some folks that are, just very minor symptoms. There are some folks that are very, very severe. So it's a very wide range of effects from our population.
Yeah. If you had to give the public a piece of advice about COVID-19 from what you have learned in the last year, what would you say to them?
What I would tell the public is that we employ almost 300 emergency providers here. We respond to nearly 100,000 incidents a year. And our folks are very, very resilient people. What I would tell the community is to take this seriously, because some of the strongest people that I know have been greatly impacted by this. This is not something that is discriminatory. It affects everybody. It's something that's very real. And unfortunately, by being careless with this virus, it could affect people that you've never met. So the toll that I see on our providers and the resiliency that they've displayed has been very inspiring. But I would tell the public to take every precaution they can, because this is not something that is a joke. This is not something that is fabricated. This is very, very real, and it's affecting people every single day and families. There are empty seats at the table at Christmas dinner. This is not something that is a joke.
Mm-hmm. No, for sure. I know at the Diocese of Greensburg, we invited Dr. Carol Fox into one of our clergy conference calls. Dr. Carol Fox is the chief medical officer, and, we have give or take 80 priests throughout the diocese at 78 parishes in 4 counties, and, very concerned and making sure that we want to have the best precautions possible to bring people into their worship site, right? And, she was talking about the stickiness of this virus, right? And how easily transmittable it is, because it's so sticky to surfaces, to hands, and that's what's really creating that. And she was talking about, the spittle, right? And how the transmission is happening in small group settings, eating, right? Eating dinner, eating together. And, that's how they're seeing the transmissions like that. So I assume that you saw a spike now here. We're about almost a couple of weeks after Christmas now. I'm sure some people heeded the warning, others didn't. So you do probably expect to see another spike.
Absolutely. We're seeing it every day. As a holiday comes near, we're almost predicting, hey, 2 weeks, we have to prepare for some more cases. And it's created an incredible stress on our system, because we expect that ambulances are able to take a call, transport to a local hospital, clean up in a relatively quick fashion, and be back in service for another emergency. But it's forced us to almost rethink and increase our staffing because of the prolonged times for these folks to disinfect their equipment, themselves, change uniforms, and be prepared for the next call. So it's really something that is unprecedented.
Do you think that some of these changes will be long lasting? Do you see these becoming protocols that are now just established and probably won't go away?
That's a conversation we have here very frequently. I suspect that the masking is something that will probably stick around for a while. The deep cleaning and disinfecting is something that we were doing previously. However, it's on a totally different level now.
Oh, totally different level. Right. Because now you're looking at virus killers. Now you're looking at a totally different kind of cleaning.
Right. So just for example, Jen, we purchased a disinfectant machine that we use on our units at a cost of $16,000 per machine. And the solution to run that, which we use about 100 gallons a month or sometimes 200 gallons a month, depending on what's going on, is like $18 a gallon. So it's a very expensive process as well.
Wow. I mean, just all of these things that had to be put into place on top of the challenges that you already face as an organization, with the aging population. I'm sure you're probably one of the few industries, so to speak, in Western Pennsylvania that continues to boom because of our demographic. So it's interesting times, interesting challenges, and you've done such a great job with all of that. I can't imagine how difficult that must be. Now, your leadership team, tell us about the individuals on your leadership team and what their hopes are for 2021.
So prior to the pandemic, we had restructured our leadership from the top down. Our administrative team is some new faces that were in the industry previously. Our CEO, Doug DeForest, has presented a vision not only to us, to our board of directors, but to our communities, our local fire departments, and his commitment in really being a truly community-centered organization. We want to be a leader in the community in any way that we can, whether that be emergency response, whether that be community education, whether that be any investment that we could make of our time, our energy, and our finances into the community is truly the vision that he has for us moving forward.
Oh, that's wonderful. I'm so glad to hear. If you're just joining us, you're listening to WHJB and Westmoreland Community Connections, having a fabulous conversation today with the Director of Emergency Operations at Mutual Aid Ambulance Service, Lorenzo Garino. Lorenzo, you guys have just done a fantastic job preparing and executing patient safety and putting patients first over the last year. I know you rely on those subscriptions. So one more time before we break, why don't you tell us how people can subscribe and what the benefits are of a subscriber?
So to purchase an ambulance subscription for Mutual Aid Ambulance Service, should you live in our response area, is to go to www.mutual-aid.com. And under the membership section, you're able to log in with your credit card information and purchase a membership. We also send out yearly mailers that will be distributed in mid to late February. We try to hit every address. You're able to call and pay by phone, you're able to pay by mail, or you're able to pay online. And part of the membership really opens up a few doors for you with copay decreases. We're able to help you with the non-emergency transfers home at a reduced rate and assist you in obtaining transports with a wheelchair van. Through doing this, it provides a vital lifelink to our community and our organization to be able to continue to send ambulances to emergencies. And without the membership drive, we would not exist today.
I want to give you a sincere compliment. You are an excellent spokesperson for Mutual Aid Ambulance. You did a fantastic job today. Lorenzo Garino, Director of Emergency Operations for Mutual Aid Ambulance Service. You're listening to WHJB and Westmoreland Community Connections. I'm your host, Jennifer Miele, and we'll look forward to seeing you next time.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of Citizens Fiber.